Hey there. So I chose the topic of socialized medicine, and more specifically, arguing for socialized medicine to be implemented in the United States. Um, Kind of why I chose this. Um, First of all, I'm, I consider myself to be pretty patriotic. So I do have a lot of pride in my country, but I also realize that with that, there are a lot of things that need to be corrected, and our healthcare system, I feel, that needs to be one of them. Um, so, looking into that, um, it kind of goes hand in hand with all of the things going on now with the race, divides, and with the wealth gap. And I think that medicine should be looked at as being a right of people. Being a basic human right. Um, in the United States, that's not really how it's looked at. It's um, it's looked at mainly as something to earn profits, and helping people is kind of the secondary aspect of it. And so that's kind of how the healthcare system is built. And aside from a few, nonprofit, charitable hospitals and organizations, that's kind of what we see a lot of. Aside from that, I have experienced, some family members who have, been in that position where they've been, gone in and had major surgery done, and came out with, even after insurance, they came out with a pretty hefty bill. So that's another reason that I chose to research more about this topic. um, and I guess third of all, just a lot of people have these predetermined um, conceptual ideas when they hear of socialized medicine or socialized programs. And a lot of people don't really know what is really involved with these these programs, or how other countries do it, or even how we have tried to do it. So those were just some of the things that I chose to, or why I chose to go ahead and research this topic. So some of the things that I expected to find while I was researching this topic was, I knew that other countries, had some of these programs. I knew that Sweden and Great Britain, they had some of those. They implemented socialized medicine. So I kind of wanted to delve into more how they were doing it, the response from their people, and you know, I also realized that there was the United States was not at the top of the world in healthcare. So I wanted to find out why that was, and um, kind of what were other countries doing that we weren't doing, and what are we doing that other countries aren't doing. Um, so kind of what I found was that, well, first, what I ended up finding, and I, as my thesis, the United States is definitely lacking in its access to healthcare. So I wanted to address that. And as a part of that, our lifespan and other quantitative measures are significantly lower than those countries a um, with socialized medicine. And there's a lot of factors that go into that. And then I also wanted to kind of go into the stigmas behind socialized medicine. I was kind of going over that. A lot of people really don't know what socialized medicine means, and it's not a gateway to socialism, and it's not that it's, it doesn't have exactly the same implications that a socialist system has. You can still remain a primarily free market economy and still have socialized medicine. So those were the definitely main points that I was trying to get at there. Um, as far as our access to healthcare, I found that uh, just like a lot of things in this country, um, the rich and the well off definitely have better access to healthcare, and that's just because here, in America, we are definitely catering to the rich, and typically you're white Americans. So that's a little unfortunate. So left out of that is obviously going to be your African American population, your Hispanic population, and then there's still a lot of underprivileged white people that just don't have that access. So there were actually a lot of statistics that came and backed that up, as far as wait times. People who have money don't have to wait that long. It's pretty much that simple, and we see that pretty much along the line. Better service, lower wait times, and those were the aspects that kind of showed me that it kind of is a profit driven system. It's We definitely don't prioritize health as much as I think we should. So that was definitely part of that. Um, I also brought up a bunch of different case studies, once again, such as Sweden and Japan. Japan actually has a really interesting system. It's a hybrid system. So they do implement private insurance, just like we do. However, they have a much larger government presence in their healthcare system. So even though they still are able to um, pay their premiums with their private insurance, the government backs them up and pays the majority of the medical bills. So I thought that was interesting. That just shows that they kind of prioritize um, healthcare much more than we do. And that goes to say with all of those countries that have socialized medicine, they have that priority. Um, Healthcare is a basic necessity in their life. Um, so that was part of that. Um, some counter arguments that I found were completely legitimate. I mean, in the United States, we had we've experienced those social programs, Social Security, Medicare, Medicaid. Those are all social programs, and what a lot of people have said is, it's Medicare has been, it's worked to an extent for a lot of people, especially those over 65. Um, but for a lot of people, they just don't see the risk benefit, and they just don't see how it benefits them. And once again, that's mostly the white, wealthier population. But so we can kind of see how that just goes hand in hand with how we view medicine. Um, but also, yeah, so that goes along with the socialism, kind of not understanding what a social program really does for us. Um, just in conclusion, I just think that if we were to view the healthcare system differently and not try to go after all those profits, it would be a little easier to find that balance that we need. And instead of a profit driven system, we need to make healthcare a necessity for all of our citizens, regardless of if you can afford it or not. So after all that, once again, I said I'm patriotic and I have a lot of pride in this country, so I want to see it get better in every way that it can. So I think that, if one day we decide to go that route, I think that we will be in good shape, and good leadership, and more education is definitely important. Kind of reducing that stigma of socialized medicine. Um, we'll definitely be able to definitely climb the ranks in life expectancy and all of those other statistics that are unfortunately against us right now. So yeah, that's why I chose to do socialized medicine, and I definitely learned something from it.